Here at Perfect White Smile in Beverly Hills, we are anti-surgery. I haven't seen any good results from surgery over my 33 years, and I would never send myself or my family members to have this surgery done. I would try to avoid it at all costs. I realize that there are probably some situations when there is no alternative, but surgery should be the last alternative, meaning you should exhaust non-surgical methods first. And if that can't happen, then yes, surgery should be the last resort. That's how I feel about jaw surgery. If it was so great and worked so well, I would send patients there all day long, but I haven't referred one patient in my whole career to go get jaw surgery. I'm completely against it, and I'm a dentist for 33 years. I don't know what I have to do to understand why someone would need jaw surgery. An overbite is really much easier for me to correct. People with severe underbites, those are much more difficult, and many times I would say that surgery may be the only alternative for someone who we call class 3. Class 3 is like when the lower jaw is really out in front of the upper jaw. A severe class 2, which is a deep overbite, that I've been very successful fixing for patients. So people with deep overbites, it's amazing. We just take the lower jaw and we put it where it's supposed to be. And there's usually a big space in the back, and we raise the bite up into that. We can correct it with ortho. I just treated a child who was 11 years old. The mother gone to 3 orthodontists, was recommended surgery by all 3. And I said, I don't understand that. We do braces here. We corrected the bite to where it should be, and then we raised all the teeth up into that bite position where he had a big void. It worked beautifully, and the mother and the father thanked me many times. I just don't understand how you could send someone to surgery, especially a child, when it can be corrected without surgery. When we take x-rays, I don't see that much skeletal distortion on an x-ray, believe it or not. They may look like they are, but when you do a CT scan, we can so much balance it on the CT scan and get it completely straight and say, you know what, you don't really have cranial distortion. That would maybe involve something for a surgery. We like to find the corrective bite. We call it a physiologic correct bite, which is harmony between the muscles of the head and neck, the jaw joint, and the bite. Once we find that position and we test it, and the patient confirms that it's really comfortable, we call that phase 1, by the way. Then we go, okay, let's get your teeth there permanently. So if you're gonna do orthodontics, we then would move your teeth into that position using orthodontics. If we're unable to do that and still want to try and get there, then I can understand that surgery may be your only alternative. But I would say most of the time, we can really help most of the patients to avoid surgery and to fix the upper jaw and the lower jaw. So I look at the upper jaw as sort of like a cage, and it's weird, but teeth like to find their friends under the cage of the upper jaw. So a lot of times what we do is we free the lower jaw out from the cage to go where the muscles want to be in the relaxation place. And then our upper cage is too small, so we have to make it a little bigger. And that's where the braces come in. We could make the upper cage a little bigger by tipping the teeth out a little and rehousing that lower jaw into a new house, a bigger house. That's how we do it. We could also do it with porcelain, which I'm an expert at. I've been doing it for 33 years. I've been crazy about porcelain restorations without metal. They look so beautiful. They're on my teeth now. They're on every tooth on my mouth. They're on my mom's teeth, my wife's teeth, as many people, friends and family, brothers and sisters. No one knows how long they last, and I think what you read on the internet is not true, because this is a science that really developed in the 80s. So how much research can be out there when it's only been out 40 years? I think that the technique is so good that it could outlive you in your lifetime if it's placed in properly. If you go to a dentist regularly, get a checkup, get some regular x-rays, and you have really good home hygiene where you brush and you floss and you take good care of your teeth. Generally what happens is when you get a smile with veneers like me, it's like parking a Rolls Royce in your garage. Now if I parked a nice Rolls Royce in your garage, would you keep it clean, or would you let dust and everything go all over it? It's hard to clean your teeth if you hate your teeth and you hate your smile. It's hard to like motivate to take care of them. Once we do this smile makeover for you and change your teeth into this corrective bite that helps your overbite and your underbite and everything, we can do it all in porcelain. It's not too late. If you're 40, 50, and I'm not doing braces, yeah, I wouldn't do them either. Knowing what I know, I would just go ahead and put porcelain on your teeth because it lasts so long and it looks so beautiful. And your teeth, as they age, they get yellow and they get worn and they lose their lackluster beauty that they had when you were 20. So, it's just time to replace them. I can correct your bite. We test it first. If it's beautiful, then we go ahead and replace it in that position. So pretty simple. I love doing deep overbites and overbites. That's simple for me. And I love changing the bite because I'm an expert at finding a really good bite. That's one of the reasons why our smiles are so beautiful. That's what separates our smiles from other dentists, is because other dentists a lot of times will just fix your teeth in your normal bite. But even if your bite is pathologic and you're grinding and you're tense and you're clicking and you have some facial pain or headaches, but you're not really relating it to your bite, they'll still just fix you in the habitual bite, which is a disservice. What you want to do is we want to find that optimum position, that physiologic position where the muscles are nice and relaxed. That's what we call a dental facelift when we see online dental facelift. What is that? That means that we've actually changed the musculature to go into like a really nice calm position. And all of a sudden it's way more in proportion between the nose and the lower chin and the nose and the upper part of the head. So that when you smile, it looks so much healthier and your skin's filled in, the teeth fill in all this cheek area. It looks so beautiful. That's why changing the bite is advantageous to an optimal end result. But smiles and function, they go together. So that's why if you have good function, you're gonna have a great smile. I always say, like, if you look at Hercules, when you look at him, you go, wow, he's beautiful. He must function well. Function and looks go together. So the better you look, probably the better you're gonna function. So what I do is I try to find a great look to where it should be. And usually that helps with the facial and everything to get the optimum result. So that's why it's good to solve an overbite. It's good to solve an underbite and to work on it and get it nice.